Hi, my name is Dr. Jackie Ho, and I work at Reproductive Partners Medical Group in the South Bay. And today we will be talking about reproductive options for same-sex male couples. We'll discuss the whole process in detail, IVF using a donor egg, and a gestational carrier for the pregnancy. So first step is to create embryos. Same-sex male couple can look for an egg donor. And how does that process work? Generally, we'll give a couple different options for egg donation. They're using what we call a de-identified egg donor. There is an option to look for either a donor who will do a fresh cycle, an egg donation cycle, or you can use a frozen egg donor, so someone that has already donated and their eggs are stored at an egg bank currently. We go over the pros and cons of each option depending on their preferences, their family building goals, and the ideal family size. In order to start looking for an egg donor, the first step is testing for the couples. They'll typically start with genetic carrier screening. Genetic carrier screening allows us to look for any autosomal recessive disorders. These are gene disorders. These can only be passed on if the parent and the egg donor carry the same disease. So basically, we're screening both partners. We want to make sure the egg donor does not carry any of the diseases they carry. They also take into account other preferences for their egg donor. Egg donors will have profiles, and you can look at their physical characteristics, family history, and a little information about their current life and personality. You can't necessarily control, this is gonna 100% have, the kid will have blonde hair, but you can pick ethnicity and the way they look, and that will influence the way the child will look. So I would say the more common route for moving forward with egg donation is anonymous or de-identified egg donation, where you're picking someone from an egg bank. An identified or known donor is someone they do know. So say someone has a friend that wants to be an egg donor, we'll also do that same kind of genetic carrier screening on them. In addition, we do egg supply testing and a medical screening to make sure this is going to be someone that's a good candidate to do egg donation. We want them to have a high success rate and a good yield of embryos. The couple will want to fertilize half of the eggs with one partner's sperm and the other half with the other partner's sperm. And we have the ability to do C or intracytoplasmic sperm injection. So even if one partner has a lower semen analysis, as long as there is reasonable sperm, we can still do IVF with their sperm. So usually, unless there is a preference for one partner to use only their sperm, we'll fertilize half the eggs with one partner's sperm, half the eggs with the other partner's sperm. We grow the embryos out to a stage called the blastocyst stage, and they have the option of freezing or transferring fresh to a surrogate. Often we will transfer one embryo at a time. Finding a surrogate is another step in the journey. A lot of times we'll start one process and work with the other simultaneously, just because it does take a while to get both processes going. With the surrogacy journey, finding a gestational carrier, typically we work with an agency, or the intended parents will work with an agency. That process can take anywhere from 1 month to a year, and can vary. And once they are matched with a gestational carrier, the gestational carrier will undergo a medical screening from our clinic. So we'll make sure they are good candidates for pregnancy, they've had healthy live births in the past, and then we look at their obstetric history and say, hey, they look like good candidates to carry your pregnancy. It's pretty good, and if there's any significant issues, like the gestational carrier has some like fibroids or something like that, or some major issue, we'll look for someone else before moving forward with the actual transfer process.